High-risk individuals have been taking precautions since the beginning of the pandemic. Now studies are showing a link between cardiovascular disease and COVID-19. Southeast cardiologist Dr. Mooch sat down with our Ileana Capian today. She joins us live in studio to tell us more. Ileana.
Good evening, Paige. COVID-19 has proven time and time again that it can affect major organs in the body. But people with pre-existing heart conditions could be even at more risk for complications.
A lot of things that we don't know, and a lot of things we have learned in the past 6 months about COVID and heart disease. What we do know for sure is that people with heart disease are at much higher risk for having complications if they do get the COVID. But if you have heart disease, then your risk even doubles at any age group.
Mooch says that high blood pressure and diabetes are common problems in the South, and patients who suffer from these issues need to make sure they are not self-treating or self-medicating.
If you were worried about having been infected or been exposed, don't make any decisions on your medications before you talk to your physician. Do not make any medication changes, just take your heart medications and talk to your doctor.
Mooch said they have seen links between the heart and the virus.
We do see inflammation of the heart muscle that may be directly linked to the COVID, to the virus.
Mooch and Southeast Cardiology continue to urge those with heart conditions to not put themselves at risk for the virus and take protective precautions.
So if you have a history of heart disease, especially if you're elderly, and especially if you have other problems, high blood pressure, diabetes, plus heart trouble, you need to be extra careful.
The Southeast Cardiology team recommends that anyone with heart conditions should limit going out as much as possible, wear masks when necessary to go out, and Dr. Mooch says, if possible, have loved ones do shopping for you to limit the risk of exposure.
All right, Ileana, thank you very much for that report this evening.